Dr. Chris Leib. So today I'm going to discuss mindfulness and its effect on chronic pain. Mindfulness has been a topic of conversation for the last several years now, and it's become more and more popular in healthcare. Initially, the origins of it were very much based in Buddhism and Eastern traditions, but it seems to have come more and more into mainstream healthcare of late. And I've certainly found value in it in my health practice over the years. And I want to discuss how it relates to chronic pain, which is something I deal with frequently as a physical therapist. So what is mindfulness? Mindfulness is the practice of maintaining a non-judgmental awareness of the present moment. And it can encompass thoughts, feelings, bodily sensations. There's a lot of different practices that we could discuss more specifically, but the broad concept here is being in the present moment and really understanding and appreciating and observing the present moment in a non-judgmental way. I think those are the two main factors there, trying to really separate out the actual present moment from our thoughts, our feelings of the future, the past, that actually could get us trapped in some feeling of suffering, where the present moment isn't as bad as the present or the past and the future that we're thinking about. So to actually bring us to the present moment is a way to often alleviate suffering. And the second piece of this, which is so paramount, is whatever the present moment is, to be able to hold that with non-judgment and not look at it with our built-in thoughts, our built-in feelings of what is good, what is bad, what is right, and what is wrong, and just literally observing that present moment for what it is and trying to strip away all of the other contexts that we bring with it based on our causes and conditions in our lives. So as I mentioned, mindfulness has its origins in Buddhism. Typically, it's very rooted in Buddhist teaching, especially the concept of sati, which refers to awareness and presence. It's integral to the Noble Eightfold Path, which is one of the major paths of Buddhism, and it emphasizes mental discipline and ethical living. So the mindfulness concept is paramount to that Noble Eightfold Path. It has, since the late 20th century, been really adapted into Western practices, mainly through the work of Jon Kabat-Zinn, who founded the mindfulness-based stress reduction program in 1979 at the University of Massachusetts. And that has since spread. I know there's a program at University of Penn, near where I live in Philadelphia. And I've gone through the mindfulness-based 8-week program that they have there. And it's pretty much directly related to the teachings and the study of Jon Kabat-Zinn. It's grown in the research since the 90s and gained traction in clinical psychology and healthcare, as I mentioned. There's an increase in empirical research that supports mindfulness and its effectiveness in treating various mental health conditions, such as anxiety, depression, and chronic pain, which is what we'll talk more specifically about today. But really, the mental health conditions, I think, can go hand in hand with many of the things that you see with chronic pain. They're not exactly the same thing, but a lot of times they're comorbidities of chronic physical pain. Many people will have anxiety and depression that is linked to the chronicity of one's pain. So oftentimes it makes sense that the treatment for one will be helpful for others. Modern applications of mindfulness, it is integrated into various therapeutic approaches, such as mindfulness-based cognitive behavioral therapy. So that's cognitive behavioral therapy is a commonly used psychological technique or behavioral technique, and mindfulness becomes a part of allowing that therapy to work better. And then it's also used in something called ACT, or acceptance and commitment therapy. All right, so these are just all taking this broad concept of mindfulness, and now there are more specified procedures that are within the psychology community that are worked on for specific therapies. But mindfulness is really paramount, or it's a foundation of many psychology or behavioral health practices. Some mechanisms of pain management through mindfulness includes having an increased awareness and attention to what's going on in our lives. So we could think of it as that mindfulness practices really enhance our awareness of our bodily sensations without immediate judgment. So the most practical way to look at this is there is the physical pain that you experience, and then there is the story around it. and being able to separate out the actual physical sensation of your pain and really be able to notice and discern the behavior of that pain separate from the story, the fears that we have behind it become a very, very valuable practice. But it is not an easy practice to be able to separate. I can tell you, if, as a physical therapist going through school, you get more and more education on what could be wrong with people, and then you can absolutely, anytime you have pain, start to think that something is wrong with you because you're constantly learning about diagnoses that are supposed to be pathologies and diseases. And we live in very much a world like that now, where as soon as something is wrong, we can just Google some term and we get a diagnosis for what's wrong with us. And it's very rarely appreciating how dynamic symptoms can be, how dynamic pain can be, and how necessary pain is and what it is. So oftentimes we get this idea of like, I have a pain, I have something I don't like. Now I have to have a diagnosis behind that. And that becomes the story as opposed to what is the actual physical, observable experience of pain, which is often not as much of the suffering as the stories around it, the fear that comes around it, and how it limits function. So mindfulness is able to help us separate out some of those very important distinctions. Another mechanism would be cognitive restructuring. Mindfulness promotes cognitive flexibility, so it allows us to reframe our thoughts around pain, changes perception, interpretation of pain. So similar to, what we just discussed about increased awareness, is understanding that the physical experience of pain is often very different than the thoughts that come around it and the fears and perceptions around it. So actually being able to work with pain and just notice it and observe it for what it is, it can make it a lot less scary, and we can feel safer with it, which allows us to be able to function better and ultimately literally decreases the intensity of pain. Similar is emotional regulation, where mindfulness helps us manage negative emotions that are associated to pain, such as fear, anxiety, and frustration. So we're looking in this case to foster more of an acceptance of pain and not having this search for elimination of it, but appreciate that pain will likely change in our body. Even when we're in a chronic state, it's dynamic. It's not always the same. It's up, it's down. Sometimes it might not even be there, and to appreciate the times that it's not there, but also to accept the times that it is there. And we've tried to make some adjustments and it's still present, that we're accepting it as part of just the human experience in many ways. So it reduces rumination in that way by learning to accept. And one of the things that can go hand in hand with the idea of acceptance is more of a parasympathetic mind state, or a rest and digest. If I'm able to be in a state of rest and digest in the body, I am by nature able to be more accepting of what is, not trying to take action and change something constantly, but be a little bit more accepting. So being able to understand the times where let me take action because I can take a immediate action and I can actually change this physical experience of pain, and the times to say like, let me just accept what is, that actually changes your physiology by putting you in a state where the nervous system dampens down and it decreases the sensitivity of pain. Similar would be stress reduction, where mindfulness practices will activate that relaxation response, which is tied into that parasympathetic rest and digest response, and it decreases the body's actual response to stress. It decreases different levels in the body of cortisol and other type of stress hormones that then have an effect on increasing muscle tension, increasing sensitivity to the nervous system. So reducing all of that does the opposite. It decreases muscle tension. It reduces our sensitivity to any sensation in the body, whether that be direct contact or some type of perception of pain through movement. More mechanisms of pain management would be neuroplasticity. So mindfulness may lead to changes in brain structure and function, which promotes neuroplasticity, which basically just means that our nervous system is able to change over time. We don't have a static brain. We don't have a static nervous system that just progressively degenerates over time, but we can make change to it in many ways. And one of those ways is mindfulness. Another way is just to move in more varied ways over time. So studies have shown that mindfulness can alter areas of the brain that are directly associated to pain perception. And these areas are the anterior cingulate cortex, the insula, just to name a few. But there is actual structures that are being changed within the brain that are much more directly related to how we experience pain than, say, a herniated disc is or a rotator cuff tear is. It's more connected to our central nervous system. And if we can make changes to our central nervous system in our brain, we're going to have a much better opportunity to change pain, especially when it's really chronic in nature. Another mechanism would be reduction of catastrophization or catastrophizing. So mindfulness can help reduce our catastrophic thinking about pain, which is similar to what I've discussed before, but there is a very real phenomena of catastrophizing any sensation that we get in the body and thinking of basically the worst case scenario as opposed to something that would be a lot more common and something that would be likely part of the human experience that will ebb and flow over time. But as soon as we put the worst case scenario into it, it actually allows an acute problem to become more chronic. So having a mindfulness practice of just being aware that we're doing that can be very, very powerful to have the natural sensations that we have in our body, that some are comfortable, some are uncomfortable, just watching them change over time naturally, being more accepting of them, not taking them into the worst case scenario type of thinking, which ultimately heightens the nervous system response and keeps pain in our body longer and actually heightens the intensity of it. Mindfulness also helps us improve coping strategies by fostering resilience and enhancing our mechanisms for coping. So it allows for better management of pain and related stressors. This improved coping can lead to reduced pain intensity and better quality of life. So similar to what we were talking about before, basically it's managing our stress response, managing our relaxation response. Through acceptance, we're able to better cope with the natural changes in our body over time, as opposed to always looking at them as a worst case scenario type of situation. So some research that looks directly at this, there was a meta-analysis by Vhoff et al. In 2016, and it examined the efficacy of something called acceptance and commitment therapy, ACT, which includes mindfulness. The objective was to assess the effectiveness of ACT in reducing pain and improving psychological outcomes in individuals suffering from chronic pain. The authors reviewed various studies, including randomized control trials that focused on ACT for chronic pain management. And the results found that ACT significantly reduced pain intensity compared to control groups, that the participants that received ACT reported improved psychological flexibility, which is crucial for coping with chronic pain, and also showed positive effects of overall functioning and quality of life. And this was highlighted in its role of enhancing emotional and psychological well-being. So the authors concluded that ACT is a promising therapeutic approach for chronic pain management, and it emphasizes the importance of psychological interventions alongside traditional pain management strategies. The implications for the individual, for the clinician, are that the findings support the integration of mindfulness and acceptance-based strategies in pain management. So, one of the reasons I wanted to just touch on the research here is because anytime mindfulness gets brought up, maybe a little less so nowadays, but certainly, a decade ago when I started looking into it, it was always tied into some type of spiritual underpinnings or some type of religion, like Buddhism, because it does have its origins in Buddhism. And if you read about Buddhism, a lot of times you get some good information about the value here. However, that may turn people off right away and also make it seem less scientific somehow, just because it has its origins in something that's a little bit more ancient. But more and more over the years, it's become just really well studied. And from a practice standpoint, to me, it's obvious when you practice mindfulness just how important it is for every aspect of life. And I look at it as similar to exercise, where exercise is just such a general term, but when you exercise, it's good for you. It's so obvious to your body. And to compare exercising to how you feel while you're exercising and when you're in a routine of exercising often and you're getting fitter to when you're not, I mean, it's obvious that the value to exercise is there. Well, that's how I would look at mindfulness. And I think sometimes there is a resistance to trying the practice because there's an assumption that, one, it's not scientific, two, it's connected to some type of religious practice that you don't believe in. It goes against your religion, or your anti-religion, your atheism or something like that. And really, it's just a cognitive psychological practice to help you improve your mind, improve your behavior, and actually see the world clearer so you could make better decisions on what's going to be useful for you and what's going to move you away from suffering in many ways. So just speaking on the research here, I'm just trying to connect the dots to some of the origins of mindfulness and where we are now in the research. And it's actually very tied into science. Another study by Hilton et al. Was a systematic review and meta-analysis that evaluated the effectiveness of mindfulness meditation in managing chronic pain. The objective was aimed to assess the overall efficacy of mindfulness meditation in reducing pain and improving psychological outcomes in individuals with chronic pain presentations. The results found that several studies demonstrated that mindfulness meditation significantly reduced pain intensity compared to control groups, that participants reported improvements in psychological outcomes such as anxiety, depression, and stress levels. And the analysis highlighted that mindfulness meditation led to enhanced quality of life and overall well-being among individuals with chronic pain. So the implications here are that findings suggest that mindfulness meditation can be a valuable tool for healthcare practitioners or for individuals outside of healthcare to use for chronic pain, providing that a non-pharmacological approach to pain, and it addresses both physical and psychological aspects of chronic pain. Another study by Zeiden et al. Investigated mindfulness meditation specifically in patients with fibromyalgia, which is a commonly seen chronic pain diagnosis. The research here aimed to evaluate whether mindfulness meditation could effectively reduce pain and improve mood in individuals diagnosed with fibromyalgia. The methodology here where the participants were randomly assigned to either a mindfulness meditation program or a control group that did not receive the intervention. The study measured changes in pain intensity, mood, psychological well-being before and after the intervention. The results were that mindfulness meditation group reported significant reductions in pain levels. The participants in the meditation group also experienced improvements in mood, such as reducing symptoms of anxiety and depression. And the study also found that mindfulness meditation enhanced overall quality of life for these individuals with fibromyalgia. So the implications here are the study highlighted the potential of mindfulness meditation as a non-pharmacological approach, specifically with fibromyalgia, but you can look at fibromyalgia as a microcosm of many other chronic pain conditions. So there are many methods of practice, if we dive a little deeper into mindfulness, to get us to understand how to use this and help enhance our lives. So, the number one practice that tends to get talked about, and I think is the most tied into what gets studied in laboratories, is mindfulness-based stress reduction. And as I mentioned before, that was created by Jon Kabat-Zinn back in the late 70s. And now it has spread to many universities and is part of Ivy League curriculum. So it's a legitimate educational program discussing the value of mindfulness for stress reduction, which is tied into chronic pain and other conditions. Generally, it's seen as an 8-week program that combines mindfulness meditation, body awareness, and yoga style practices. Similar to this would be mindfulness-based cognitive therapy. So that is an adaptation of cognitive behavioral therapy that is commonly used by most psychologists nowadays. And then this adds the mindfulness component to the cognitive therapy to prevent relapse in individuals with recurrent depression. Again, this program, similar to the mindfulness-based stress reduction, usually lasts for about 8 weeks, teaches participants to observe their thoughts and feelings without becoming attached to them and promoting healthier cognitive patterns. Loving kindness meditations, or I've seen these as metta meditations, many times involve silently repeating phrases of goodwill and compassion towards oneself and others. Closely connected to this are gratitude meditations. So as things are seemingly not going so well for us, to be able to actually sit and have gratitude for what we do have and wish ourselves well, wish others well, can be a very powerful practice for changing perspective in any moment, bringing us to a different present moment than the physical pain that we might be feeling, and really just trying to practice the feeling, the physical manifestation of what it's like to be grateful and to love and really care for someone else, to love and care for ourselves. It's a pretty powerful practice when you sit down and you don't just give it lip service, but you really try to feel it within your body and within your mind, within all of the systems of your body and feel that for somebody else, it's hard to not change your moment, your feeling at that time. So it can be a very powerful thing. And when you think about any of these practices, it's one thing to discuss the value of mindfulness. It makes sense from a cognitive standpoint. Like we can understand why you might want to do it. But then there's sort of this idea that, we don't need to actually practice it. And to me, it's sort of like trying to get more fit without actually doing the work, right? It's like we know that exercise is useful for us. We can read about exercise, we can understand all about the value of it, but if you don't actually do it, it actually becomes useless. The same thing when it comes to mindfulness, that it's not just understanding that it's a thing that's useful, but it's a thing that has to be built over time. And, it's a muscle in a way that needs to be trained. It's use it or lose it. So sometimes just spending 5 minutes, practicing could be so powerful, but you can't do it once. You have to do it on a regular basis to remind yourself to fall into this way of thinking a lot of times, because it's certainly not intuitive. And with practice, it can become more on the surface for us, but it's something that needs to be practiced like anything else and can be built over time. And with a building of a mindfulness practice, my experience is that it's harder to feel suffering in the way that we would feel it in the past, because we have way more resilience, not just in our bodies, but in our mind and our emotions. And I feel like that is a harder thing to touch, where there's more things that can touch our bodies physically in an obvious way, but there's less that can touch our minds. And if our bodies are struggling, if we have a practice that are keeping our minds and our emotions strong, then we can be more resilient to more things. Another method of practice is body scan meditation. So this is a technique that involves systematically focusing attention on different parts of the body, promoting awareness of physical sensations and relaxation. So again, it just brings us to the present moment, but it does it in a very specific way where we're just looking at our body from head to toe or toe to head, and just trying to really bring our mind there. I've heard it referred to as body listening, where we're listening to different aspects of the body. And I kind of like that description, because when you're actually in practice of it, there's a different feeling when you're just trying to listen to something. Because listening to me indicates that there is a letting go and accepting of what's around and what's coming into my ear holes. I'm not trying to take action in any way. I'm just literally listening, and I'm passive in that process. And I think if you approach it that way, it becomes a lot more valuable than just trying to maybe check a box. I was like, oh, there's my foot, there's my knee, there's my hip. But I'm actually trying to just be and accept whatever I'm noticing. And you could be systematic in how you go through the body and noticing it, but the observation and the curiosity that comes from that observation, I think, is the value there. And it can be very, very valuable. This is very similar, and can be really considered the same thing as something like a yoga nidra practice, or as Dr. Andrew Huberman likes to refer to it, as non-sleep deep rest. And it's a very similar practice there. So another value could be if you're having a hard time sleeping, you actually can't physically get to sleep. Sometimes just doing these body scan meditations, they may actually help you get to sleep, or it could be a nice substitute for sleep, if there is such a thing, to get your body to be in a better physical place, even if you can't actually get official sleep. Another method of practice would be breath awareness. I've done several podcasts on the breath and the value there. One of the values when it comes to mindfulness of the breath is your breath is always there. And there's different ways to use the breath to allow us to be more mindful of that present moment. So we could use the breath as an anchor to bring us back to the present moment. And we could do this in a couple different ways. One, we can actually have a very specific way we're using the breath, but we're trying to breathe in for a certain amount of seconds. We're trying to breathe out for a certain amount of seconds. And that's one version of mindfulness. In that case, we can also count the breath so that we're really trying to stay on the breath. If we notice we've lost our count, we can go back to the beginning and just have like a more objective goal for trying to stay in the present moment. Or I think a more powerful practice, but sometimes a more difficult practice, is literally just watching your breath and trying not to change it. And that can be quite hard. So as soon as you want to focus on your breath, you'll notice that you want to change. You want to take a deep breath in. You may be wanting to hold your breath more than usual, but you want to change the nature of what you're doing in some moment just because you're watching it and observing it. So just trying to be a third party observer and not trying to actually change behavior just because you're watching with the breath becomes I think a very powerful practice as well. But either way, you're staying in the present moment and you're staying as non-judgmental as possible. And nowadays, especially with all the discussion about breath work and what's the right way to breathe and what's the wrong way to breathe, it becomes very easy to use the breath in a way that actually makes you more judgmental. So I think it's just something you have to be careful with there is when you're doing any type of breath practice, even if you give yourself a specific goal, it's not about doing it right or not doing it right. It's just about being aware and noticing. And if you have a goal and you notice that you're not doing what your goal is, there's no judgment there. You just go back to the instruction and just keep going with it. But one of the hardest things to do is trying to get out of the habit that you're trying to do something right or wrong, but you're ultimately just an observer. And to be a non-judgmental observer is the value of mindfulness. And sometimes it takes a little while to appreciate why that would be valuable. But when you find it, you won't dispute it. Another practice could be mindful walking, which is while you're walking, you can walk slow, you can walk fast, but you're just noticing the contacts of your feet to the ground. You're noticing the rhythm of your body with walking. Typically, this is done in meditation sittings in a rhythm or a superset with sitting meditation. So you'll do typically more time sitting, maybe like 40 minutes of sitting and then like 10 to 15 minutes of mindful walking. And it helps to change the body posture, but the whole time your body and mind are focused on the present moment. So walking is a little bit more dynamic than static sitting, but ultimately the intention is the same. I find that very, very valuable, especially having an understanding of the gait cycle in some ways, just to feel where I'm making contact with my feet, feel how I'm shifting weight as I walk. It's a very powerful practice, and being able to move from slower to faster and having different awarenesses, different observations that happen as speed changes becomes, I think, very powerful. And gait, taking this out of a mindfulness state, but back, into more of a specific movement practice standpoint, gait is so powerful for rehab. If you understand walking better and you understand it more thoroughly, you can use it to your advantage in so many different ways to help with recovery, to give you actually mobility that you've been losing, or just really having an awareness of where you might be compensating and be able to change that through mindfulness. And the last practice I'll mention is mindful eating. So we all eat on a regular basis. So having the opportunity to feel the food in our mouth, we can feel where we're chewing it, what side of the mouth we're chewing it on. We can have a specific goal with that, very similar to focusing on the breath, that the chewing of the food, the taste of the food, it's observational. So we're just really trying to take that whole experience in and get as deep into that experience as we possibly can, which tends to slow our eating down. But it also just brings us in the moment where we're not eating while we're doing something else. We're really, really staying present in the eating process. And that's been demonstrated to be useful for calorie control and weight loss because we're not going to overconsume as much when we are mindful of how we're eating, or because as we are focusing on something else, we can eat a lot faster. We don't even recognize how much we've consumed. When we're mindful of it, we're more aware of the process and we realize maybe when we've had enough. So some apps that are really useful nowadays, apps can rule the world, and I feel like apps have become more and more useful for helping us with healthy lifestyle choices. There's a ton of mindfulness apps there. My favorite one is Waking Up by Sam Harris. It's just, to me, it's just so thorough. It's got good conversations in there if you want to learn about the value of the process, and then you just got the direct mindfulness practices, and it's really just from any tradition you can think of. He's got it on there. There's really no bias towards one type of thinking. And it's one of the things I love about it is that you get a nice diversity of thought and diversity of practice on there. But it is such a valuable app in my experience. Calm is another one that's a little bit more commonly seen, and I think a little bit more commercial, but has like so many valuable things on there, stuff to help you sleep, guided meditations, many things on there. So another nice app. Happier, I think it used to be 10% Happier. It's based on the work of Dan Harris, who wrote the book 10% Happier, and I believe he is a broadcaster, anchor or former anchor on ABC. And now he has an app on there, which I also find to be really good. They have a lot of great, well-known meditation teachers on that app. An app I use all the time, and I've gotten a lot of really good feedback from clients, is something called iBreathe, which is really just a simple tool, and it's basically a timer specific for the breath. So you could customize your breath for how long you're breathing in for, how long you're holding after the inhale, how long you're breathing out for, how long you're holding after the exhale. There's some that are pre-programmed in there, and then you can customize as many as you want. And it's just amazing how the app itself and having something showing you how long you're breathing in for and what your breath is and following that for an extended amount of time, how that allows you to stay more in the moment. And it gives you something that's quantitative to follow. So I find that to be very useful myself. And I've gotten a lot of good feedback because it's very simple. You don't have to navigate anything within an app. So some of the apps that I really like for mindfulness, they have so much information that can be overwhelming to people, where iBreathe is really very direct. It's just put in your timer. It's basically an interval timer for breathing. But as you follow it, it really can show you some of the benefits of breathing that if you're counting your own breath, you might not be able to get. Something similar is Oxygen Advantage, but this is tied into the work of Patrick McKeown, who he does a lot of work with breath holds to try to improve tolerance to carbon dioxide and imitate some of the values of altitude training. I've read his books and I've done a lot of his work, and I've just found it super valuable for my fitness. But a lot of the work that he does also teaches you to breathe in a manner that is much less effortful. And I found that to be very valuable for bringing my stress response down. So he's got an app too that is more direct. It shows you some of the science behind it, but it gives you specific practices to work on that will help you kind of get into this zone of breathing, which, from a physiology standpoint, one of the major things it's working on is improving your tolerance to carbon dioxide. So one of the ways to think about that is if you hold your breath, you're eventually going to get to a point where you feel like you need to breathe in. What's the difference between someone being able to do that for 2 minutes and someone only feeling like they can do that for 10 seconds? Usually it's their tolerance to carbon dioxide, as opposed to being some type of specific lung capacity thing that some person has more capacity to tolerate gases than other. It's more of a sensitivity to that carbon dioxide that as we build up more tolerance to it, it actually becomes pretty calming in the body. It can lead to some parasympathetic assistance, so we can get a reduced activity of our nervous system, as I alluded to before. So being able to, with control, hold the breath longer, but not do it in a manner that's really forced, can be super valuable for it, actually changing the physiology of our nervous system. Another one that I've used in the past is Muse, and I've gotten this headband that it comes with that gives you biofeedback for getting into a more relaxed or calm state. I haven't used it in a while, but they have an app and different tools that go with the app to help you get a little bit more feedback for your relaxation response, which can be quite useful for many people. And then another app that I use quite a bit with a heart rate monitor is Elite HRV. So HRV refers to heart rate variability, which is a physiological metric for your stress response. Are you closer to fight or flight? Are you closer to parasympathetic state? The Elite HRV will measure that for you, among other things, but it also gives you specific mindfulness meditations that are connected to the heart rate. So it's another version of biofeedback training to get you into a calmer state or help you feel the difference between getting HRV that's a little higher versus a little bit lower, higher being actually closer to a more parasympathetic state. So in summary, mindfulness has the potential to reduce pain intensity and improve pain-related outcomes. It also enhances emotional well-being by reducing anxiety, depression, and stress associated with chronic pain conditions. It improves overall functioning and quality of life, allowing for more active engagement in daily activities. And it provides an alternative or complement to traditional pain management strategies and a reduction of reliance on those medications. These effects are accomplished through things like increased awareness, cognitive restructuring, emotional regulation, stress reduction, neuroplasticity, and the reduction of catastrophizing or worst case scenario thinking. So hopefully that was useful. I can tell you from experience, mindfulness has been one of the most powerful things that I've discovered in my life. I initially got into it about the time that I gave up alcohol, and it became such a valuable tool to make that possible and make that not feel as arduous, just in having me view the world a little bit differently. And I've spoken about where my mind was when I was drinking when I was younger. And I just remember just living in this world where, yes, I wanted to do well and succeed, but ultimately all I was looking to do was do well and succeed so I could get to a point where I would have less responsibility so I could enjoy my social life a little bit more. And what mindfulness did is it really just restructured my thinking about what a good life looked like. And it wasn't even about the drinking and the hangovers and things like that. It was just the awareness that that type of idea of what happiness was always going to fail. So just having this appreciation that the only moment that matters is the present moment, and becoming more observant of that and finding value in that can make any moment an ideal moment. And like when you can figure that out, then you actually have a lot more resilience with more things and more resilience than you think. And I certainly have discovered that, but it is a practice. You have to keep coming back to that idea. But with practice, even when you sort of lose your way, you know it's there. You know you can come back to that anytime. And a lot of times you can come back to it quite quick where things are feeling pretty shitty. And then all of a sudden, because you have this mindfulness practice, you could change your perception in minutes. And that becomes a really, really powerful practice. And nothing external has to change. You just have to bring your mind to a different place because you have that practice. So that's my personal experience. I was trying to give the evidence so that this isn't too much about my personal experience. But one of the reasons I wanted to bring this up is I can't help but make it part of what I do as a clinician nowadays, especially when I work with those that are trying to make change to their behavior or that are in chronic pain. Mindfulness has to be part of that process, but it's going to be a different process for every individual. But making it important is a good start, and then you'll figure out how it's useful for you. If you want to get in contact with me, you know where to find me, movementprofessional.com. Find me on Facebook, facebook.com/movementprofessional. Instagram, at movementprof. And I just came out with a new subscription service on my website called Longevity-Based Training. It's based on my first book. So if you really want to prioritize your workout regimen for life, check that out. Put a lot of work into it. I think it's pretty thorough. If you have any questions too, I'm very easy to access as you're going through that program. If you want to get some advice right from the creator, I'm happy to discuss with you. I'll see you next time.